Thank you, Denise, for your introduction. I am now going to go over some interventions for elimination, sleep, foot care, and skin in the elderly. And we'll start with urinary incontinence, as you can see right here that I have listed um, for the elderly. And basically, with urinary incontinence, it's just the involuntary loss of urine. What we have found is a lot of times it's environmental barriers that make it difficult for the patient to void. So sometimes there are problems that prevent the patient from getting to the bathroom or removing their clothing or transferring to the toilet. If you can get the patient on a toileting schedule, that will, guarantee the patient a designated time for voiding and then reduce episodes of the incontinence. As you can see here, I have limit fluid intakes 2 to 3 hours before bedtime. And by restricting the fluid intake and voiding before bedtime, that reduces the need to disrupt the sleep for voiding. I do think that it is promoted when the caregiver responds promptly to the patient's request to help with voiding. So these would be some interventions for urinary incontinence. Okay, although you have urinary incontinence, you have diarrhea, they're common in the elderly. The main problem is constipation. And with constipations, I've found with the elderly, it's a lot of times due to a sedentary lifestyle. A lot of times they're sitting all day or they have lack of exercise or prolonged bed rest that contributes to the constipation. Drugs can also be a big problem because that can slow down peristalsis. Many times it's the narcotics that contribute to the constipation. Defecation is a private thing, so you want to promote privacy with the elderly so that they're able to eliminate as a free will on their own. Even though I say to increase the fiber intake, you don't want to abuse laxatives and enemas because that can cause muscles and the nerves of the colons to function inadequately. Insomnia. Insomnia is another big problem with the elderly, and here you have some nursing interventions for the insomnia. A lot of times it is related to anxiety, but the amount of sleep that the elderly will need will be individual to that particular person. If you can get them on some type of ritual or routine, then that will induce comfort and relaxation for them to be able to sleep properly. You do want the patient to be able to sleep through the night consistently, so you don't want them depending on sleeping aids. If you can know the causative factor of what is the problem while they're having the insomnia, then a lot of times then you can implement the change. These are the interventions for insomnia listed here. In regards to the skin, as stated earlier by Denise, there are many skin disorders of the elderly, some cancerous, some non-cancerous, but it is important that these interventions that I have listed here are implemented so that the elderly can take care of their skin. As they get older, the skin becomes thinner and drier, and that's really easy for injury. Also, with the elderlies, if there's a skin infection or a non-healing wound, that could be serious or even fatal. So it's very important to follow these interventions. With extra care, it's definitely needed for bed sores because that's very common in nursing home among the elderly patients. Foot care, foot problems can have a negative impact on their daily living. You want to have good foot care in order to decrease pain and increase their mobility and physical activity. Therefore, that increases the self-esteem in the elderly as well. With these interventions, I'm also going to suggest a podiatrist because a lot of times their toenails become really thick and they're unable to reach their feet and clip their toenails, or they may have visual impairments or arthritis that may prevent them from doing this. Going to go over the teaching and learning strategies. So as again, just to reiterate, these are some teaching and learning strategies that you will implement. Some for insomnia, skin, and foot care. Of course, you want to exercise, you want to moisturize. And a continuation, make sure you wear your shoes at all times to prevent foot injury. Again, the podiatrist, and definitely will report changes. I'm now going to introduce Lana, who's going to go over some alternative care options in the elderly. Lana?